There are currently 2 laparoscopic adjustable gastric bands that are approved in the United States for the treatment of obesity. In my left hand is the lap band, in my right hand is the Realize band, and both of the bands function the same way. They have an outer case of silicone and an inner balloon. The lap band's balloon has these serrations in it, whereas the Realize balloon is a straight, even balloon. And the balloons are attached to ports that are placed underneath your skin, allowing us to blow up the balloon, creating a valve on the proximal portion of the stomach. So the way a band works is we place this band around the first portion of the stomach, and then we blow up the balloon so that food hopefully gets caught on top of the balloon and can stay in your stomach longer, as well as reduce the quantity of food that you eat. I think that the most important thing that I try to relay to patients is that the purpose of our operations is not just to make you eat less, but also to make you less hungry. The advantage of the lap band is it's the simplest effective surgical procedure that we can do. For proper patients, it can even be done on an outpatient basis. We can hide the scars by placing the port in the abdomen so that no one even could tell, even if they saw you without a shirt on, that you had lap bands or Realize band surgery. One of the things that's really important to realize, though, is that banding becomes more challenging after the operation is done in terms of living with a band. As a result, the recovery from banding is faster than any of the operations. The risk of serious complications is lower, but the outcomes are more variable. We have patients that have phenomenal weight loss with banding. We also have patients that lose very little weight and find living with a band increasingly frustrated. What our goal is to explain to you when we see you, as well in our seminars, as well as when we see you in the office, is how a band works and how you can make a band work for you. One of the common things that people hear is the band is the easiest operation to beat. I'm not sure if that's really true. I sometimes wonder if the band gets beaten because patients are hungry. And it's my thinking that bands are very effective in relieving hunger in about 75% of patients. But the other 25%, and I wish I could identify them preoperatively, just don't get that same satiety factor from lap band surgery that they may get from one of the stapling procedures.